been in regular contact with Amelia Lobo. She asked me if I would be interested in doing that because I had mentioned I needed something to get me out of the house every once in a while. I think that as a country we owe it to all of our citizens to have health care. The one that struck me the strongest was a gentleman from Ukraine. He had two questions. The first question was, why can't I just go to the doctor when I want to? He was used to, if he was sick, going to the doctor, never worrying about paying or anything, and getting taken care of. And I didn't have an answer for him on that part. The second question that he asked me was, how much am I going to have to pay when I go see a doctor? And again, I couldn't give him an answer because, as you know and I know, it depends on why and where you're going. It's different at every place. And so it was a little frustrating for me to not be able to give this gentleman any information that would reduce some of his frustrations. He really needed to get to someone who could help him with the application process to understand what would work best with him. I have good health care because my wife's still working, and she has good health care. For years she has been a good consumer, and she happens to be able to open enroll every year at several different plans. When our children were young, we had several medical issues with them. None of them life-threatening, none of them prolonged, but as a parent with young kids, it was very nerve-wracking to, first of all, make sure your children were adequately cared for from a medical perspective, and secondly, that you could afford to do that for your kids. And so, simply by nature of the title of the law, Affordable Care Act, depending on who you want to talk to, it is still trying to get more insurance and more coverage for more people, and I think that's important.